Pod Talks is a great opportunity to discuss about hot topics today with relation to the digital transformation. It's a unique opportunity to meet experts from all around the world and to understand their experiences and some success stories that can help us to open the mind and think about how technology can transform the life of citizens.
So the event today on the data revolution in healthcare was very interesting, very attentive audience. I think we had some great panelists to speak about the potential uses of data in healthcare. And I think it's important to have these kind of open discussions about what it means and what we should be expecting from data and how to maximize the use of data in healthcare.
We were completely focusing in different topics that are today's topics and main topics about the data, the privacy, and how to manage this information regarding health.
In fact, what I said, thank you very much for the organization. This event is a fantastic event.
The audience has been very participative with making very interesting questions. So at the end, I think it has been fresh, spontaneous, but very productive.
There's some very interesting topics covered today. So they included everything from, how does data going to be used in the future in clinical practice? How do we understand population health with data? But perhaps the most interesting for many in the audience was this question about how do we use individual personal data in order to improve our own health, to share it with others, who owns the data, what kind of expectations can we have about managing confidentiality and privacy. So we need to resolve all these things because they're to do with transparency and allowing people to understand that when they give data freely, that they know how it's going to be used in the healthcare system.
Regarding the summary of it, I would say, number one, data are going to drive big changes in healthcare and healthcare management in the coming years. We have to pay attention to this. Second, value is a great topic to take in consideration for the future. Healthcare systems are going to shift from buying or paying for activity instead of or towards paying for value.
I think we bring some quite interesting topics around the sustainability of data, the quality of the data, the interoperability of the data, how we can create more data and generate more data by using Citizen. But one thing that I want to bring is the patients. At the end, the patients are owning the data. The citizen is owning the data. The people are owning their own data. So I think we need to think more on the patient's life, people's life than just with drug or stuff like this.
The relevant topics for me, it was completely about data, how to manage this information, how we could take profit about this information and use this information in order to improve the quality of life of our today's citizens and the future patients.
Regarding the trends of the future, this value-based healthcare, I think it's going to be important, but also the integration and the cooperation between different actors of the sector, providers, hospitals, patients, and healthcare authorities, the public sector. Together will provide the development that's needed.
The evolution in the future about health industry and data, that's completely aligned. We need that the data is more and more used in order to improve health of the people. I think that today data is less used by the population because we are a little bit scared about this data privacy, but we need to lose this fear and begin to push in this sector.
We all know that healthcare systems need to change. They were not designed to deal with a lot of the chronic conditions that we have today. They were really more designed to deal with infectious diseases and with things that happen very quickly where you can get in and out of hospital and to deal with them. We're now in a situation where we have to start looking at more chronic conditions, and you can see that data has just the potential to transform how we evaluate risk of developing these, how we can engage people in their own health sooner. And I think ultimately, the whole of medicine is going to be very much both being about evidence-based, but also generating more evidence all the time in practice. The idea of practice-based evidence, generating more and more insight into what keeps us well, which are the most cost-effective and effective therapies, and how do we, use that to redesign our healthcare system of the future?
I think the future will be really fun. I think the future will be fantastic, but it's a creation of an ecosystem. And I think at Barcelona, with the big company, but also the startups, the financing environment, the hospital, etc., you can create something with value. And I will just share this definition that I'm sure somebody has already shared, but value mean that this is the outcome under the cost of delivering this outcome. And I think it's a new mindset, in fact, to think about how you can generate data and what will be the future.